Hi everybody, Dr. Howard Cohn here at the Cohn Health Institute with Dr. Charlie Fagenholz, and we are excited because we are doing this segment of the Go Beyond Summit. And Dr. Charlie is a phenom at the Cohn Health Institute and beyond. His background is amazing. There are so many different certifications and things that he's done at such a young age. I've been around this industry a very long time, and I'll meet people that are experts in the field and practice for 10, 20, 30 years and still don't have all the certs that this guy has. And to watch him work with patients is phenomenal, and to see the kind of changes that he makes with his patients is really what this summit is all about. So Dr. Charlie, give us a little background. I know there's a lot. I mean, we can take up the whole 45 minutes just going over everything you've done so far. Talk us a little bit about your background, how you came to what you're doing here.
Sure. So, hi everybody. I'm from Chicago, Illinois originally. Grew up and I was your stereotypical sick every week, chronic problems. I was at the doctor's office at least once a month. I've had so many things that I can go on about, but I don't want to bore you with that. And really, it was time, it was just enough. And I went to chiropractic school. A chiropractor helped me through some basketball injuries. Didn't know, what was really possible in that realm until later in life. The universe acts in weird ways, right? So went to chiropractic school and started practicing with a buddy of mine who was a year ahead of me. And he started doing this muscle testing stuff to me, and he was asking me if I was interested in it, and it was really foreign to me. So at first, when something's foreign, it's kind of uncomfortable for you. So I was kind of like, I'm not that interested. Then I let him treat me, and it was the best. I treated me for about 20 minutes. It was the best I've ever felt in my whole life. I was 23 years old at the time, and that was that light bulb moment where as soon as I felt that, I knew this is what people in this world need. And that really put me on a journey that I would have never predicted, and it's been the best journey of my life.
So you started with being a patient, obviously having good chronic health challenges growing up, and always been into athletic sports, basketball, other sports.
That's right, basketball mainly, but volleyball, football, baseball.
Cubs,
right?
It is the year. It is the year.
That's right.
That's right at this filming. So, so walk me through this whole thing. Now, when people look at the kinesiology world, there's a vast amount of different techniques that are done to help people with advance their human performance. But you also do some really neat things that we haven't seen anyone else in the summit do. Things that are old school arts. Dating all the way back to beyond Bernard Jensen, even back to the days in Germany of iridology and sclerology. And sometimes people see a chart, they know that their whole body's represented on their sclera and their iris of their eye, but they might have seen it at a health show, a health fair, but they never seen it really applied to the athlete.
Exactly.
What are you looking for when you're looking at your athletes?
Sure. So the first thing I do on everybody is look at physical markers. And that's your fingernails, your tongue, and your eyes. Now, I'm very interested in a lot of things, and most people who know me know that I'm a seminar junkie. And I like to just sit there and just learn any little clinical pearl that I can and kind of put together a toolbox that would be like the most in-depth look at somebody. So athlete would be a perfect example. And it's not limited to athletes, but athletes obviously are a huge portion that benefit from this. And you mentioned iridology and sclerology. And those are the study of your eyes. The sclera is the white and the iris is the color. Now, there's sayings that say the eyes are the windows into the body, and there's a lot of truth to that. A lot of people will look at that like, oh, that's kind of too out there for me or whatnot, but the eye has a direct correlation into the brain because the nerve from the brain goes directly into the eye, cranial nerve too. So a lot of people say that you can see things years before they manifest. It's really, the whole thing that really jumped out for me is it's better to stay well than to get well, and that allowed me to ask a certain question. All of us use kinesiology, we use muscle testing, and if you're not asking the right question, then how good can you be, right? So when I saw the eyes, some of the stuff, when someone read my eyes, I was blown away. They told me about my mental states, my emotional health. I've twisted an ankle, like you have a left ankle problem, things that I was like, there's no way you're guessing this, it's way too spot on. They're even saying the time frames that happened. And so I really set out to get a diplomate in iridology because that was something that I believe that people needed. So, like I started off saying, it's better to stay well than to get well. Say athlete comes in and they want to prevent injuries. Well, injuries can be prevented in many ways, but if you see that there's some kind of inherent weakness, so to speak, you want to go to those places first. So say I look in the eye and there's some kind of hip issue. Well, these days athletes, if their hips aren't working, most athletes can't perform. So instead of waiting for it to happen, why not find out why the hip isn't where it needs to be and kind of prevent it from going through? So it's been huge. I mean, it's been a huge advantage to treating all types of patients, especially athletes.
Well, definitely, and a lot of times people don't realize, you'll watch somebody like, as you know, an athlete get an injury, and you've seen them get hit like that. If let's say it's a football, like he's gonna get hit like that 10 times. Like, how did that injure them? And it always is, when you look at it, if we had looked at those certain markers were there before to let them know that they were set up to do it. That's pretty much kind of what you're saying.
That's
there,
right, yeah.
And you can even see those in the eye.
Absolutely.
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 And,
the sclera is more of the physical body, where the iris is more of the chemical internal body. So together, I think they go really well together.
And then in the next step, and I know we're going to demo on somebody shortly, but how you apply it when you apply kinesiology. You talked about that as the foundation, and then these different other techniques that you've kind of sprouted into. There's CRA, there's TBM, there's NET, there's quantum neurology, and I know that throughout this program we're going to have different people highlight maybe some QN quantum neurology, maybe some NET neuroemotional technique, but CRA and TBM, tell us about those, because again, just in my experience, I've seen it used on the chronically ill, I've seen it used on people that have been everywhere, done anything, no one's helped them. How about athletic and human performance?
Sure. So we started off with CRA, so I'll start there. Contact reflex analysis is a profound technique in just dealing with the body from a whole perspective. That's structural, chemical, and emotional. And a lot of times athletes are so focused on just the structural, somewhat the chemical, right? But then there's the emotional aspect. So CRA kind of highlights the priorities of the body, and it allows the body to show you what it wants dealt with in what order, which is just as important as identifying it. So on top of that, TBM, total body modification, has these little clinical pearls for patients. Like, one thing's called cardiac low back is a perfect example. People have low back pain all the time, especially athletes, and they'll have physical therapy, they can have surgery, they can do whatever it is. But cardiac low back is something that I've seen help athletes time in and time again. Cardiac low back is a subclinical heart thing, whether it's not enough oxygen to the tissue, things like that. And it allows you to really tap in to ask the certain question to identify it, and then if you can find it, you can fix it. So TBM has a lot of clinical pearls like that to help patients recover quicker and remove those roadblocks so they can get to peak performance.
That's awesome. Now, you had mentioned physical, nutritional, emotional, and I know a lot of our different docs, especially here at the Cohen Health Institute, have that broad spectrum look at an athlete. So walk us through some of that. I know physical, a lot of times it's the quantum neurology, the biochemical. It's not just what we're deficient in. Everyone's worried, what do I need to perform, but what do I need to take? But it's also what we are toxic in, and I know that you spent a lot of time in the world of showing athletes how infectious agents like bacteria, fungus, yeast, parasites, things like that we just assume are things of the sick, are affecting everybody, allergies as well, and then the emotional side with NET. So you can just kind of, again, we're going to demo this, so picture's worth 1,000 words, but if you can kind of walk us through conceptually those three things.
Sure. So structurally, we're going to talk a little bit about QN, quantum neurology, and we have Dr. George who would be on this. So make sure you tune into him. He's the master, he's the starter of it all. But clinical pros from there, chiropractors since day one have been adjusting people. And his whole thing was that nerves can be the thing that really is the cause of more so than the bone. And that is taking the nerve to the muscle relationship and turning that on, and then taking it a step further and putting you through your daily activities, whether it's a pitcher throwing it, quarterback throwing it, someone running, a golf swing, a volleyball spike, and you doing that and seeing where your nervous system breaks down, and then basically rehabbing that nerve into, okay, I'm congruent with this movement now. Now, furthermore, then we talked about NET, and I think you'll be talking about NET, possibly.
Probably.
Yeah. NET is, neuroemotional technique. How many times has someone said that the game is 80% mental, 20% physical? You hear that all the time. And there's a lot of truth to that, because a lot of us carry around this baggage, this subconscious baggage of emotions that are limiting us on the physical level. And NET allows you to tap into that and find out where it really started and why in the crunch time of the game, why is that person not performing the way? Are they getting in their own head? A lot of people say that you have to defeat yourself instead of your opponent, essentially. And NET allows you to overcome any type of blocks within you. Now, chemically, you talk about infectious agents. Now, George Goodhart, may he rest in peace, one of all of our mentors, started applied kinesiology, and he came up with organ-muscle relationships. And you know, it sounds out there, but it's really not, because the nerves go to the organs, go to the muscles as well. And so say someone has a knee problem, you know, in this world, knee problems are adrenal issues. Adrenals are your hydration, your cortisol, you know, all that. And say that those aren't functioning, the muscle's gonna shut off, even if you rehab it structurally, even if you can do any motion on it. If there's a chemical deficiency there, then you need to get the adrenals working. Now, we talked about excess. In a world full of toxins, poisons, you know, we're eating this gluten, this dairy, this genetically modified stuff. People are eating so much sugar that just inflames the GI tract. People are eating a crazy amount of sushi. We have pets that can transmit bacteria and all that. So we are prone to getting all these type of subclinical infections. You know, if you miss that, that is a huge thing to miss. And you need to fine-tune, you need to get it out of the body, you need to fine-tune it, get the muscles working properly, get the organs functioning properly so the nerves start doing their thing, and it all comes together, painting that picture for the patient.
So another thing, just to highlight it, maybe you can tell us some stories of actual patients that have had this. I know that you know, we have to really look at people in their environment, and we've all seen, let's say, the patient who's a baseball player or a football player or a golfer. And those fields aren't naturally that beautiful and manicured. They are tended to. And one of the things that keeps it so green are things like pesticides, herbicides, fungicides, all these different kinds of toxic chemicals, where these players have their face, their hand, their sweat in these all day. And we'll have people come in where they'll have different biomechanical issues that they think are really structural problems for injuries, where they turn out to be toxic overload of a circuit that might shut my shoulder off because of a liver, or, you know, shut my knee off because of like the adrenals, like you said. Talk to us a little bit about that, because even it's not just infections, it's even the toxic chemical part that people, they never even thought about. And that's just one, is swimmers with the chlorine toxicity, and we can go on and on. So I know you got some good stories. Maybe, you know, the stories are...
I got a good one that pops up. So soccer player, she came in about a month and a half ago, and she came in with chronic left hip pain. And she was doing PT, she's been to a chiropractor. She came in here, she was referred in to see us. And first visit, you know, I balanced the muscles of the pelvis, you know, the hip flexor, the glutes and all that. She comes out, she says, yeah, I feel better, I feel more stable, but every time I get on the soccer field, within the first 10 minutes it comes back. So then I'm thinking, okay, so she's on a soccer field, they're treated with pesticides, herbicides, fungicides, all that kind of stuff. And her muscles, the same ones I fixed a week earlier, were all back to being weak. And the next thing I checked was something called the allergy point from NET. And sure enough, when she touched the allergy point, all her muscles turned on. Now, that tells me that there's some type of allergy in her body that's kind of short-circuiting her nervous system, shutting off her pelvis muscles, then she can't perform, she's getting pain. So she tested for a homeopathic, called allergy spray, and it was something she was breathing in, which was probably herbicides, fungicides, pesticides. And as soon as she went on that, she literally was pain-free, her performance just boosted. That was one of the miracle stories that people hear about, and she should be forever grateful for that.
So that's awesome. I know you have lots more, but here's what we're going to do. We're going to segue a little bit, because I know we can talk about it forever, but if you haven't seen it done, and again, you got to get in to see this guy. I know you have to see remote patients, and people send you pictures of their eyes and all kinds of stuff, and there's some things that can be done virtually, but I know the Cone Health Institute where you're at is right on the runway at the Orange County Airport.
Right next
flying in all the time. So definitely come out to Costa Mesa, schedule an appointment with Dr. Charlie. But he's going to walk you through what it actually looks like to take a patient through where they're at when they come in, to just an example of some of the many things. If we really looked at detailed everything, this thing would be 5 hours long. So we're going to kind of give you the editorial kind of version of what a treatment and what an exam may look like. So we'll be right back at you. Here we are, back at you with the very lovely Casey, who is going to be our demo, our model today. And she's not actually just a model, but she is actually a patient of Dr. Charlie Fagenholz as well. And Casey, before we get started, and Dr. Charlie just takes a look and kind of demos on you, kind of how he does what he does, tell us about one of your times that you've been here and what the experience has been.
Okay, I came in to see Dr. Charlie for knee pain, which has been chronic my whole life. I have subluxing patella, so the side of my knee has a lot of pain. When Dr. Charlie was going through a protocol and testing me, he linked it back to a scar from my umbilical cord.
Wow.
From when I was born. I was wrapped around my neck. So and there's other emotions around that. Anyway, so he did quantum neurology, QN, which is a technique that he uses a lot to help with moving pain and energy out into the body. And then got on a couple supplements too to help support that.
And how's it been?
Feels good. Yeah.
Awesome.
Great, yeah.
I love it. Now, as you can tell, and we've talked about this before, not the average rehab situation that you would see going to a traditional, let's say, physical therapist, rehab person, or doctor, or ortho, or even chiro. So, there's a saying about the human body, which is anything could cause anything. So, and Dr. Charlie is so great at ferreting out all these weird and wonderful things that could be keeping people from going beyond. So, and your background is growing up or track and field running?
Yeah, track and cross country,
And cross
dance
country.
when I was very young.
Nice.
Now I do yoga, which helps with of course, chiropractic as well, but it helps with keeping the structural part of my system kind of intact.
Beautiful. So, thank you for that, Doc. Walk us through, let's say this is her first visit, and just walk us through what we're going to do.
So I always start out with physical markers. So first look at the fingernails. Okay, look pretty decent. A little bit of a lunula, which is the moons on her pinky. So first I'm thinking there could be some kind of heart disease in her family history. So I'm always going to check on her heart. Now, is there any type of heart stuff in your family, or?
Not that I know of.
Okay, so it could be further back, in generations that, before you knew them. Then I look at the tongue. So quick little screens. You see your tongue. Okay, so her tongue trembles. So the first thing that I see is tongue trembling, blood sugar. Heart is very related with blood sugar, as are the adrenals, and it's yellow. So some kind of fungal yeast type thing going on. Can I see one more time? Yeah. How's digestion? That would be my second question.
It's been erratic for many years.
Okay.
Yeah.
Okay, so there's one piece of the puzzle. So go ahead, look up to the ceiling. Now I'm looking at her scleras. Surprisingly, her scleras are remarkably clean. I see a little bit of liver toxicity.
So what are you looking for?
So when you look in your eyes, you have your blood vessels. And the blood vessels pretty much represent congestion. The thicker the blood vessel, the more congestion. The more convoluted it is, the more congestion. Now you're born with some of them, but most of these develop over your life. Look to the right for me. Look to the left for me. Okay, a little bit of the endocrine system, so thyroid, adrenal gland congestion. The thyroid is shoulder muscles, adrenals are knees. I know you came in with a knee problem, so from the structural level, I'm looking at possibly her knees or some type of shoulder problems. Also, I see a little bit of an emotional sign, which is you're not the best at expressing your feelings. You kind of hold stuff in. I don't know how accurate that is. Would you say that you tend to go towards that?
Yes.
Yeah.
So besides the blood vessels, what are some of the things for our viewers that you're looking at that give you that information?
Yeah, so
Is it all blood vessels?
So that last one was actually, there's on the lateral corners of her eyes, she has a little bit of a yellow, it's called the pinguiculum. So that doesn't mean much to you guys, but that is basically, it looks like a little blob of yellow. And it's very slight, it's not very noticeable, but for me when I see it, it's developing, so we can kind of halt that, so to speak. I want to look in her iris now. Start with the right, look straight through here. Now we talked about how we can have people send in photos. That's one way of doing it. This is more of a live analysis, which I kind of prefer. Okay, so now in this eye I see definitely more GI stuff. And there's, like I said, you're not good at expressing yourself. There's a portion in the eye that's called vocabulary expression, one of my mentors, his whole breakthrough was he found emotional states in the iris. So 2 things pointing to you don't express yourself properly, and that can hold stuff in, cause you to become acidic, which is the second sign I see, is acidity. Now, when you're acidic, you lose your minerals. So the first thing I'm thinking is you may be mineral deficient, and minerals are what make everything in the body work. And without those, every process in the body can't function optimally. So we have these right here. This is a mineral supplement, alkaline boosters. This would be one of the first things I probably would test on her from a chemical standpoint. Emotionally, would tap in with some NET. We may see me do that in a bit. But I'm going to go off to the other eye. Look straight through again. Good job. Still, I see similar signs. In this one, I see more of lymph congestion. And ironically, lymph congestion, from an emotional standpoint, is not expressing yourself and holding stuff in and being down on yourself. So that could be an NET type thing that we can dive into. Also, if your lymph is congested, then you can't detox properly. Earlier I said that I saw fungus on her tongue, or it's some kind of yeast problem. Well, if fungus isn't lymph, isn't circulating, then you can't detox the fungus in the first place. So it's kind of, the eyes kind of tell you a picture, painting a picture of the human body.
So let me just kind of, for our viewers, I know that we had talked about digestion. She has different signs for digestion, and if I'm at home and I don't understand any of this stuff, I'm thinking, how does that affect me as an athlete? Can you walk through us, because I know that your quads, which people who are runners are considered, relates to her small intestine in applied kinesiology. She talked about her patella, where you were an original injury related to this, her TFL, and even her stomach meridian goes right through her knee. Can you kind of walk through that, because that's so vital right here? And then the emotional stuff, repressed, shutting it down, is creating these patterns. People getting rehab, PT, all these different things done to their muscles and their ligaments, and doing all these exercises, and it's still not hitting it.
Sure.
Kind of fill that gap for them.
Absolutely.
Yeah.
So a picture's worth 1,000 words. Let me just demo it and talk through that.
Let's do it.
So fungus, talk about small intestine. She had chronic dislocating patella. And so I'm going to start on the right. I'm going to actually start on the good side, because a lot of times the side that you think you don't have the problem is actually the weak side. The other side is compensating, so to speak. So I want you just to raise this up. This is her quad muscle related to the small intestine. A lot of times fungus and yeast kind of manifest in the small intestine. So you're going to resist. I'm going to push down. So that actually tests okay in the clear. I'm going to go to this side. Hold strong. And that one's good as well. But if I just stop there, then I would probably miss it. You got to ask the right questions. So in the clear, they're fine, but go ahead and touch over the small intestine right here. Bring this up and hold strong. And there it goes. There goes the weakness. You're going to try, but it's very hard. Go to this one. It shuts down both of them. Okay, so that is from a chemical aspect. If we don't get that fungus under control, then her quads neurologically will never stabilize. You're going to get hip problems, knee problems. Sooner or later, fungus is going to cause other problems. Headaches, trouble sleep, it could be anything. It can cause anything and everything. We talked about anything can cause anything. This is a perfect example of that. Then I'm going to take it even a step further. Go ahead and touch there again. Bring this up. I want you to put that hand on your forehead. Hold strong. And that strengthens that up, which means that, I talked about how the lymph's not circulating, fungus can't leave the body. But lymph also goes with you being down on yourself for not being able to express yourself. So if I didn't get to the emotional aspect of it, would I ever be able to get her lymph circulating 100%? Probably not. And that's where the kind of the clinical pearls come in. I also want to test another muscle related to the adrenal glands. So bend this in. This is just sartorius. Comes from the hip and attaches to the knee. Hold strong right here. See, now that's weak in the clear. Go ahead and touch your hand on your forehead. Hold strong. And that strengthens up right when she touches her forehead. So far I have 2 things pointing to emotional causes being the main thing. So I'm going to go in and I'm going to clear that. Okay? You okay with that?
Yeah.
Okay. Go ahead and hold strong. Just test an anterior deltoid. Okay. I want you to put your hand on your belly. Okay, she weakens there. I'm going to go here, and she strengthens. So that tells me that there's some type of emotion, which we already uncovered. So go ahead and take that away, and we're going to clear that. So first thing is there's 2 major concepts in life. Money, job, career, and finance. Hold strong. Okay, as soon as I say that, think about relationships. Okay, you're in the clear on that one. Think about money. Think about career. Think about finances. Okay, so it comes up as finances. So I'm going to touch different reflex points and it comes to the spleen, which, believe it or not, moves lymph, creates lymph tissue. So I want you to think about a couple emotions, okay? Think about low self-esteem, oversympathetic, think about nervousness, think about your nervousness. Okay, so in life right now, you don't have to say it out loud, you can think it. If I had to say nervousness and finances, could you put those two in a sentence that makes sense to you in your head?
Yeah.
Okay. Can you think about that?
Yeah.
Go back to your past. Okay, so this is a current thing. So I want you to touch right here, this hand on your forehead. And I'm going to tap a certain sequence. Go ahead and breathe in and out for me and think about that thought. That's going to basically retrain the nervous system, essentially, and break something called a neuropeptide, which is a stress response that the body will hold on to until it's able to be released through something like NET. So go ahead, hold strong. Okay, now that's much better. Now think about that, that thought that you were just thinking about. Hold strong. Good. Okay, I want to see if I just affected the small or the quads by doing that. So go ahead and put your hand on here. Bring this up. Hold strong. That's good. Take this one up. Hold strong. So an emotion was the basis of all of it. And that kind of clears out. I like to do things where I get a lot of information and see if one thing's causing multiple things, kind of like pinpointing the true cause. So if I were to just treat the fungus without doing the emotion, I wouldn't have really gotten to why the fungus is there in the first place. So that's the first thing. Okay, and next thing I want to kind of go into is, so you don't have any, your knee pain's decent now, anything else bothering you?
Well, I have like a tiny little canker sore on the tip of my tongue.
Oh, those tiny canker sores look at you.
I mean, you can't see it, but I can feel it's like
Sure.
like a tingly feeling.
Okay, so when she says canker sores, I think first off of some type of chronic viral thing or a B6 deficiency. And in a world that is so filled with EMFs, electromagnetic frequencies, computers, TV screens, Wi-Fi networks, you're chronically being depleted from your B6, which will actually lead to a lot of food sensitivities. So there's a clinical pro right there. So I want you, are you able to touch it?
Mm-hmm.
Okay, I'm going to use another deltoid test. Hold strong. So when she does touch it, there's something, her body's not congruent with it. So I want to see what's causing it. So go ahead and touch there. We're going to go into these vials over here.
So just for our viewers at home, can you just touch on how this all works?
Sure.
There's a good chance this is everyone's first time seeing it. Like muscle, what's happening here? I touch this, it goes weak or strong. How does that work? And maybe about what you're about to lead into what you're doing.
Great question. A lot of people, we do our Wednesday night health classes every Wednesday at 7 p.m. This is a lot of the first questions people ask. How does it work? Why does it work? And really what it is the brain is the master of the whole body. So the brain has a perfect image of everything in your body. Let's call that the reference beam. Okay? Now, humans are electrical. We're made up of mostly water, so if I get electrocuted and I touch you, she's going to get electrocuted. And it's kind of the same premise. We generate electrical charge. You can measure with a magnetometer. Long word, just measures electricity. And so what happens is when you touch an area in your body, say it's the small intestine reflex point, acupuncture points, the brain sends an object signal to that, so to speak. And if the object signal doesn't match up to what it should be, even 1% off, the nervous system will downregulate and a muscle will test weak, neurologically inhibited. Not like she's gonna lose in a strength contest, so to speak. It's not a strength contest at all. It's just a question to the nervous system. Can she handle this stress or not? So when she touches there, the brain sends a signal, that's not exactly how it should be, so that every single muscle in her body will test neurologically inhibited while she touches there. Now I'm going to look for what pulls her out of that. So I pulled out these vials. These are vials that have a little bit of particles in there, the most common stressors that allow people not to heal properly, so to speak. These right here are chronic infections, and these right here are food sensitivities. There's other ones over there, but I want to start with the chronic infections because most times canker sores are viral. So I want you to go ahead and touch the...
And those are homeopathic, you don't have the actual infections.
Yeah, no, homeopathic.
Okay.
Hold strong. Okay, so when I put the homeopathic on her body, the frequency changes the muscle test. And that's going to tell me that one of those is the reason why that's not healing. So go ahead and touch one more time. Okay. So I'm getting that it is a virus indeed. Sometimes could be a fungal thing. I saw fungus on her. Okay, and it's virus 1, okay? Doesn't matter what it is. All that matters is how are we going to treat it? How are we going to, get the body congruent with healing itself? So go ahead and hold that. When she holds that, she'll shut down. There's these little finger modes that I'm going to test. If she strengthened that, that would be herbals. If she strengthened this, it'd be homeopathics. And if she strengthens to this, it would be a nutrition. So I'm thinking possibly L-lysine breaks viral replication cycles. I believe you may be on L-lysine. But I want to do one more demo just to show how powerful this is. She's a flexible person. Go ahead and lie on your back for me. She's a yoga instructor. She flexes. She's very flexible. Go ahead and relax. I'm just going to do a general stretch test. That's actually, is that where it would end right there, would you say? Okay, now just by putting this, go ahead and hold this. She's under the frequency of her body healing that, so to speak. Now if I did this, that's an instant change, showing that the nervous system, go ahead, sit up, holds these things, and if you can change the nervous system, you can change things like performance. Like she's a yoga instructor. What yoga instructor wouldn't want to be more flexible, so to speak? What athlete wouldn't want to have better ranges of motion and all of that? So that's just one demo of how you can find the true cause of something going on. And it's not always one cause for everything. Everyone's a biochemical individual. So there was emotions, there was an infection going on, obviously limiting her range of motion in her hip. Would she be able to teach yoga as well as she could? Probably not. Now, doing this, gets a peak performance. I know she'll love that.
Beautiful. Very exciting. So, there's a lot of stuff there.
Yes,
and when we do our follow-up session, there'll be some Q&A, and we can fill some of those gaps. I know when people are watching this, they may have some questions. Some people are familiar with muscle testing and muscle function testing, but it may have not been a technique like some of the things you did. And I noticed when you were doing the emotional part of the NET that you said stuff and like the muscles would turn on and off, which is really wild for people to see that can happen. But I'm sure if you have questions that'll be explained. And talk to me just for a little bit about what's unique here with you is that we can go to somebody who is a CRA practitioner, TBM practitioner, or a sclerologist, or an iridologist, or an applied kinesiologist, or an NET practitioner, or a quantum neurologist, but to be able to do it all in one umbrella and knowing what to do when. Talk to me about how that's really helped your athletes go beyond, as we say, and go to the next level.
Yeah, so earlier I said that I'm kind of a seminar junkie, and I will attend any seminar just to find one clinical pro that can change someone's life and that made it worth it for me. And I would say one of my strengths would be that I can take a lot of information and put it in a system that makes sense. It's all different types of techniques. It's structural techniques, emotional techniques, and biochemical techniques. Everyone's a biochemical individual, so not everyone, if someone came in with a canker sore, there may be, 10 different treatments for that canker sore. And really, that's where the miracles happen, because there's another saying that people always say is don't be the jack of all, or don't be the jack of all trades, master of none. But if you can take the clinical, this is my opinion, if you can take the clinical pearls and what you've seen work from techniques and make your own toolbox, but understand why it works the way it does, then you're able to tap into the body systems a lot more thoroughly. So someone like we're talking about athletes, someone coming in and they have some type of dysfunction, whether that's they can't break their own personal record, they have a chronic injury that no one's been able to fix. Anything can cause anything. So when I'm looking at someone, pretty much a million things are running through my head. I started off by looking in her eyes. I kind of did my best to go through that and talk about how lymph is a certain emotion. And then on her tongue, fungus. Well, lymph has to work in order for fungus to get rid of itself. So that's where my mind kind of paints a picture, and the body is very, very complicated, but very, very simple at the same time, because it paints the picture in the way that it will allow you to do things in a certain order if you ask the right questions. So doing all of that stuff has allowed me to ask the right questions in the right order to get that athlete to that next level. Whether it's a structural thing, an emotional thing, or a chemical thing, or all of it. You know, everything can affect anything. And that's really been the biggest difference maker for me from going to all these techniques and seminars and meeting people and networking and all that.
So couple last things for this segment. I know that people are now watching this going, oh, I need to see Dr. Charlie and have him check me out and see what he can do to help me go beyond, because there's so many different things that you're looking at.
Yeah.
How do people find you who are watching this? There might be something that pops up on the screen, you know, they can get your contact information, but how do people find you now?
Sure. So ConeHealthInstitute.com, I have a webpage on there. On Instagram, CHI.DOC7.2. Follow me on Facebook as well at Dr. Charles Fagenholtz. Those would be the best things to reach me at, but coming into the health classes here to ask the questions, all that kind of stuff, that would be the best, so you can really see how we operate, and come see me.
And lastly, you know, between the nail, the hand, fingernail diagnosis, the tongue diagnosis, the eyes in and out, scleroderology. What is something that somebody can do right now who's an athlete that you commonly see if they're standing in front of the mirror? They can stick their tongue out, hold their fingers up, they can just look in their own eyes a little bit. What would you have? Give me one or two things you'd have people look for right now and go, oh, I'm glad I tuned in.
Yeah.
I got that.
Okay, so first thing is, if you look at all your fingernails, you have your moons, so the white part, the lunulas. You should have them on every finger except for your pinky. And if they're not on every finger, then the nutrients aren't getting to all your tissues. So that's a huge thing. That's circulation into your tissues. That's how you heal. That would be number one. That's a huge one. The second one is, if you look in your eyes, now in the right lighting, if you look in the color part of your eye and you see these rings going around your eye on the outside, you're already mineral deficient. You're so acidic that's where you really want to get minerals in your body, because without minerals you can't function properly, you can't rebuild tissue, you can't perform properly, you can't break your own records, perform at peak performance. Those would be the two biggest ones and the easiest ones to really see.
So I'm at home right now and I'm looking in the mirror and I'm looking at my fingernails and I go, oh, I got no moons, and as we call them, the lunas, and I'm looking at my eyes, I'm seeing that ring. Until I can get to see you, what do I do? What am I doing?
So exercising aerobically would be one, in your heart rate zone, which is a whole nother topic that we can get into. Also, I'm going to get some kind of good minerals. You know, I showed the alkaline boosters. Those are my favorite minerals. That's going to get you good, because it's hard to get minerals from food these days. If people haven't recognized, our food sources aren't the greatest. Our soils are dead. And so a good mineral supplement like that would be vital to something like that. Also, don't drink fluids with your meals, because you dilute your stomach acid and you're not breaking down your food to give you any type of chance to absorb whatever minerals are left in our food supplies. So those would be two easy things to really do.
Awesome. Also that I know that because I attended one of your lectures, now speaking outside of the Cone Health Institute, not just around the community, but around the globe, and I attended your lecture that you gave on molecular hydrogen and the use of molecular hydrogen in sports performance and athletics, and do you want to get a little tidbit about that, since we got you here, and since it was so well attended by doctors internationally, who many were hearing this for the very first time.
Yeah, which was a surprise to me. Some of the best doctors from around the world came. There's about 200 of them, and they'd never heard of molecular hydrogen. And that's really the supplement that we have here that takes athletes to the next performance, or next level of performance. And I can talk a whole lecture about molecular hydrogen, but really at the end of the day, what it does is it helps you recover from whatever you have to recover from, whether that's rebuilding your muscles after a sore workout, getting you through that, you get sore after workout, lactic acid secretion, and then you're stiff and all that stuff. This is going to help you recover faster from that because it's the only thing proven to really reduce lactic acid in the tissues, and that alone can make you, that next level athlete because you're not going to have to deal with all those types of performance dampers, so to speak.
Nice. So lots of tools, lots of tricks, lots of things that you're using to help people go beyond. We appreciate you and your time. Thank you, Casey. And we'll see you soon. We'll see y'all soon. Bye for now.